The last thing you want when you've just been diagnosed with a cancer is to have all of the administrative burden associated with actually getting your treatment. If a patient can come in, consult with their doctor, go straight through for treatment, have the treatment, and not have to worry about filling forms, securing funding for treatment, making sure their medications arrive on time. If we can eliminate all of those in terms of that pathway for the patient, that's going to relieve stress for the patient and make their journey as seamless as possible.
We've come up with a discipline-specific solution, which we call HealthONE Oncology. And what the solution basically does, it enhances and brings efficiency within the oncology practices to drive a little bit more with regards to how patient centricism, as well as the efficiency of practices working, and as well as the doctor and partnerships that associates themselves to those practices.
One of the weaknesses of software systems I've used in the past is that software gets designed by software engineers and the system is thrust upon the clinician. I think the system is different because we did the opposite. We allowed clinicians to develop system. We had clinical nursing staff involvement in terms of the process flow within the chemotherapy suite, because unless you know what happens on the ground, you don't know how that system is going to help or hinder you in your daily activity. It's critical that for an oncology patient, they stay on schedule with their treatment. Bringing the pharmacy in is a natural solution, because the more you coordinate patient care, the better your treatment outcome is going to be, the better the journey is for the patient.
At most of the strategic oncology practices, DISCEM has a warm-body pharmacist that sits within these practices that contribute quite highly into the patient management and treatment when it comes to having the drug medication mixed and ready that's being administered to the patient.
I think the collaboration in terms of this partnership is really essential in terms of improving the patient experience. And that's ultimately what we're focused on.
And with Altron HealthTech, from an AI perspective, from new technology perspective, and transitioning into healthcare with IoT, we're bringing that standardization. And once we have standardization, the richness of the data that we have now can contribute to the bigger data play.
Where the major potential of the HealthONE ecosystem is in future use of artificial intelligence to drive improvement in patient outcomes.
Knowing the advancements of technology in the day and age that we live in, what better way for healthcare to transition into that space, and Altron HealthTech leading that transition.